go in this door. They've got it locked too. I don't know. I don't think my keys work in the clinic.
Or maybe some of these folks up here, I bet you they have one. Huh?
I'm sure they probably do. Corey, do we have a key to the clinic door over here?
Why is it dark in here?
Well, this clinic's been closed because we don't have providers to staff it. I think we have 14 people laid off so far.
To be in this clinic that is totally empty, not providing care for your community, how do you feel about that?
Wow, it bothers me, much like I'm sure it bothers all the other rural communities that are in the same situation that we're in.
Falls Community Hospital is struggling because many of its patients do not have health insurance. And it's a statewide problem. Texas has more uninsured people per capita than any other state, 4.7 million. In 2013, Washington said it would pay to expand health care coverage to 1.5 million of the poorest Texans. Texas lawmakers, including Governor Rick Perry, said no. They just didn't trust Washington.
It tries to blackmail the states into taking this money now, and then a couple of 3 years down the road, the money's not there. You're going to have to pay for it.
The thing I'm talking about is Medicaid expansion, and Texas decided not to take it. So 6 years later, I want to know, was that decision good for Texas? While Medicare is health insurance for retired people, Medicaid provides health care for low-income children and families and people with disabilities. The Affordable Care Act, Obamacare, expanded the net to millions more poor and working poor families, making them eligible for health care through Medicaid. Under the plan, Washington pays 100% until the year 2020 and then 90% after that. Enter Dr. Ray Perryman, Texas economist.
Is it okay if I ask, are you Republican or Democrat?
I'm neither.
Back in 2013, Perryman wrote a report that predicted with expanded healthcare coverage, Texans would be much healthier and more productive. He claims this would have grown the state's economy.
So, I mean, you're talking about an enormous amount of economic benefit that could have occurred as a result of this.
In terms of a policy, not taking that money at the time, you felt what?
It was a big mistake.
Why a big mistake? Well, Perryman predicted refusing the funds would mean all those people without insurance would be a drag on the economy.
Not saying Medicaid's perfect, not saying the Affordable Care Act was perfect, but given the rules that it set out, that it really didn't make sense for Texas to do anything but expand Medicaid. Of course, we chose not to.
Back at Falls Community, more and more uninsured patients who can't afford a doctor show up in the ER when they're sick, which is the most expensive way to see a doctor.
Because so many people in Texas don't have any kind of insurance, is this kind of like their doctor's office?
Yeah, the 17%, use the emergency room as their primary care physicians. So,
and you can't turn them away?
No. We probably wouldn't anyway.
20 states did not expand Medicaid, and according to research in the journal Health Affairs, rural hospitals in those states have closed at a rate 6 times faster. In Texas, that's 21 rural hospitals that have closed, more than any other state. The amount of money this hospital now spends treating uninsured patients since 2013 is up 53%. Jeff calls it bad debt.
Why is your bad debt growing?
Because we have less people that have insurance. Most rural hospitals in this country work on a margin that's between 0 and 1%. And that's not a book of business you necessarily want to go into.
On the other end of the hospital spectrum is the massive John Peter Smith Hospital. It's run by Tarrant County. And I'm talking about the decision not to expand Medicaid with the county judge, Glenn Whitley.
Has that decision been in the best interest of taxpayers?
I would say that's hard to determine. I am comfortable with the decision that was made.
Not everyone is. The Commonwealth Health Fund says not expanding Medicaid has left many low-income Texans less able to afford their medical bills, to pay for needed prescription drugs, and to obtain regular care for chronic conditions. And look at what's going on at JPS. It spends almost $1 billion a year treating uninsured patients, a 22% increase from 2013. But Whitley says JPS is actually financially healthy and property taxes here are under control. What he still has is a healthy mistrust of Washington.
If the federal government were to balance their budget, they, like the state sometimes, how do they balance that budget? They stop paying for it and force local folks to pay for it.
And you're worried that's what's going to happen?
And I'm worried that that's what's going to happen.
So, 6 years after declining Medicaid expansion, where are we? Well, 1.5 million poor Texans did not get health care coverage. Rural hospitals are struggling, and local taxpayers are paying the bills for uninsured patients. But Texas leaders believe Washington will eventually shift costs back on you. And while that could happen, it hasn't happened. So when you ask, was it good for Texas to decline Medicaid expansion, the answer has to be no. If you've got something you want verified, send me an email.